Well, good morning and welcome back to our final fabulous segment here on Cityline. With me, I have two women that when you look into their eyes, it is the epitome of hope. They know what they're doing, they know why they're here. So let's get to know them. Please join me in welcoming Alicia Morales. You are the Hope Program Co-Manager for the City of Tacoma. Welcome, my dear.
Hello.
It is so great to have you here. Look at that smile.
Thank you.
You are doing what you were supposed to do in this life. You have that look. And so does Miss Cassie over here. Cassie Halstone, you are the co-manager also for the Hope Program. So you guys are the peanut butter and jelly. You guys
Perfect.
are,
Yeah.
I have a friend that she and I call each other Wilma and Betty. So you're the Wilma and Betty of the Hope. First off, I'd like our audience to get to know you. So Alicia, what is your history and how long have you been in this position?
So I started with the Tacoma Fire Department in April of this year, at the beginning of April. And before that, I was working in the community behavioral health field and then in the True Blood Settlement Agreement programs.
Yes.
So I was a forensic navigator for a period of time in Pierce County, and then most recently was working as the program administrator for the outpatient competency restoration programs with the Healthcare Authority.
Wow, are we lucky to have you? Holy cow. Okay, Cassie, I already, in the green room, you two love each other. Big fest here.
Yes.
So Cassie, give us your background and how long have you been in this position?
Thank you.
You bet.
So I also started in April with the Tacoma Fire Department Hope
So
Program.
who has seniority?
That's
Yeah.
the co-component.
At the same time.
Yes. Where I lack, she picks up, and vice versa.
Yes.
It's very collaborative and wonderful.
And what was your background?
So I'm a licensed marriage and family therapist. I've been providing behavioral health in Pierce County for the last 17 years. But most recently, prior to this role, I was working as a designated crisis responder with the Tacoma Police Department.
Wow.
And so it was co-response in the community, more client-based contact. And so what's really unique around our dynamic is she comes from legislation, leadership. I come from boots on the ground. And so we're trying to blend how to make a full system work. And it's really neat.
I hope every policymaker, every director, every person in charge of HR is watching this. This is what we call a perfect hire.
Thank you.
Thank you.
We hired you for your life experience, for the compassion, for the radical empathy you have, and now you're just flying. Man, you two are something. So I want to ask the question, Alicia, what is the Hope Team? I love the name. And how is it different from a current first responder system?
So the HOPE team stands for Holistic Outreach Promoting Engagement, and we are a specialized team that consists of a behavioral health provider and a registered nurse who go out and respond. So we support the traditional first responders who are going out on scene, and then we are also supporting the community by providing that specialized behavioral health, mental health, and substance use component for people who are calling 911 and requesting emergent immediate response.
Wow. So would you say, yes, Amanda, that's correct, if I said you guys follow around emergencies, fire department, the police department, when there's a fire, when there is a domestic situation, your department is there. Is that right?
So some of those instances, yes.
Okay.
So we are doing a soft launch right now, and so we are engaging in those more follow-up response and responding with the request of the first responders that are on scene. And as the program grows, that will change.
Oh, I love this. Well, I'll tell you what, I mean, I've had some first responder situations in my life, and let me tell you, I would have loved to have had your two faces there as the crowds got bigger and people started to break down after what they saw. So this is something whose time has come. We are in such a state of trauma right now because we don't know how we're going to ever get back to if there ever was normal. And underneath that COVID cloche, people have lost cars, lives, jobs, houses, it's trauma. Children are traumatized right now. So this is a position whose time has come. So speaking of that, Cassie, what were the reasons or needs for creating this HOPE team that we would recognize, and also some that we wouldn't think about?
Such a great question. So I think, as you were mentioning, we are seeing an escalation in symptomology across our entire collective.
Great word.
There's more unhoused individuals or unstably housed individuals. We have more mental health crisis, behavioral health crisis, and substance use. And so back in 2021, our community, primarily the AIR Coalition, really sought to advocate for this special demographic to have a higher level of care. And so they went in front of the city council, our wonderful mayor and city manager.
We are the city of compassion for a reason.
We are, and we are creating innovative programming around alternative response. And the city very much responded to this outcry. And so they partnered with Matrix Consulting and implemented an alternative response study where they were looking at how can we change the impact? How can we actually change our system? And they created a 3-tiered process. So the City of Tacoma has created the HEAL team, which is specifically set forth to help unhoused individuals get into stable housing.
I've watched them in action, yes.
Yes. And they've created the HOPE team, which is set forth to dispatch through 911 as an aid to first responders to address mental health, behavioral health, and substance use, and provide alternatives and less restrictive options to keep someone in the community. So with traditional models, when you have fire, EMS, or law enforcement, typically they need to disposition the call by taking someone to the emergency room or incarceration if there's criminal behavior. And so when we are able to help come up with a less restrictive alternative and help them stabilize, we hope that that's a solution, because the behavior really is a symptom of an underlying problem. So we want to have that soft touch for the underlying problem. And then public safety was the third component. And so the Tacoma Police Department is rolling out a community service officer program that should launch early 2024.
I sat in a meeting with Chief Police Avery Moore, and he talked about that. And I was like, oh, I love this. So Alicia, tell us how the HOPE team works and how HOPE supports the community.
So the HOPE team consists of, will consist of, the position is still posted and we're still looking for an advanced registered nurse practitioner who will provide medical oversight and medication management services, as well as medication assisted treatment. And then the field response team consists of a registered nurse and a behavioral health crisis responder, so somebody who is considered a mental health professional. And then we also have a behavioral health case manager to provide preventative and follow-up outreach to people that have had contact with the field response team. So we're really providing a whole service to people to ensure that they not only, when they're in crisis, that they're getting that whole person support, because the registered nurse can provide basic physical health assessment as well as physical health and wound care. And then the crisis responder can provide those components of crisis de-escalation, safety planning, risk assessment, reaching out to natural supports if somebody is safe to remain in the community and in their home, or connecting to other resources like crisis stabilization facilities if somebody does need to go somewhere and is willing to go voluntarily. And so our services are all voluntary, and so we support the community in that way. And then we also support first responders, because we are stepping in to provide a service that they have been providing and are not necessarily trained to do that. So we're allowing them to be subject matter experts in the place where they are subject matter experts.
I love that, in a kinder, gentler way to handle a crisis. And also when you talked about the follow-up, the integration. You know, in the past, decades ago, if somebody had a mental crisis, they went away, and then when they came back, there was no following up. We didn't integrate them back into society. And this program, absolutely, when someone gets home, says, you're not going to be doing very well, you need some healing, can we bring in some meals? Do you know about some other things that will help you? So, my goodness. So, last few minutes here, first off, I want to find out, who do we need to thank? And both of you, who do you need to thank? Go ahead and go first.
So we would like to thank the Tacoma Fire Department leadership, who's been incredibly supportive, especially Chiefs Green and Holman.
Yes.
And the City of Tacoma itself has also been incredibly supportive. Cassie and I attended a study session on Tuesday, and it was just really great
The
to
joint
see.
one between Pierce County?
Yes.
Oh,
Yes.
I wanted to be there.
Yes.
Who should you thank?
We do. We definitely want to highlight all of the city. Additionally, HR and IT have really helped us do the heavy lift of our build to get staff onboarded, as well as to build our database. And anyone else that's had a touch with our team, we really appreciate all the involvement.
I want to say thank you to both of you for being on the couch today. And as this starts to take off, I'd like you back on the couch so we can check in and hear what you need from us as a community, all right?
Thank
Thank
you.
you.
Oh, yes.
Deal.
Thank you.
That wraps up another great segment of Cityline. It's always a pleasure and a privilege to be in your home. We've given you some really wonderful things to think about in this past hour. So go out there, be a part of the tapestry, and above all, pay it forward. And when you come back, as always, we'll be waiting for you right here at Cityline. Take care.
Tacoma, that's my home, from the pines to the dawn. Tacoma, that's my home, yeah. Tacoma, that's my home. Tacoma, that's my home, place I call my own. Tacoma, that's my home, yeah. Tacoma, that's my home. All right, you're from the East Coast. All right, you're from the West. All right, you're from the middle, but Tacoma's still the best. All right, you're from the East Coast. All right, you're from the West. All right, you're from the middle, but Tacoma's still the best. Hey, Tacoma, that's my home, from the pines to the dawn. Tacoma, that's my home, yeah. Tacoma, that's my home. Tacoma, that's my home, place I call my own. Tacoma, that's my home, yeah. Tacoma, that's my home. Tacoma, that's my home, from the pines to the dawn. Tacoma, that's my home, yeah. Tacoma, that's my home. Tacoma, that's my home, place I call